People who are thinking about mixing and matching.
The World Health Organization's chief scientist on Monday advised against people mixing and matching COVID-19 vaccines from different manufacturers, calling it a dangerous trend since there is very little information on doing so.
So it's a little bit of a dangerous trend here where people are we're in a data-free, evidence-free zone as far as a mix and match. There is limited data on mix and match. It will be a chaotic situation in countries if citizens start, deciding when and who they should be taking a second or a third or a fourth dose.
Dr. Soumya Swaminathan made her comments during the WHO's latest online briefing. Infectious disease experts are weighing whether people who received Johnson & Johnson's single-dose vaccine should receive a booster of the Pfizer or Moderna mRNA-based vaccine, which are said to be more effective against the highly contagious Delta variant. One of those who did mix and match is Dr. Angela Rasmussen, a researcher at the University of Saskatchewan's Vaccine and Infectious Disease Organization, who made headlines after she said on Twitter that she had gotten a dose of Pfizer's vaccine in June after receiving J&J's in April. She also advised other J&J recipients, especially those living in areas with low vaccination rates, to talk to their doctors about doing the same. Separately, Pfizer is pushing U.S. and European regulators to authorize a third booster shot to supplement its two-dose regimen. But health officials, including the WHO's Swaminathan, have said there is no medical evidence that a third Pfizer shot is necessary.
It has to be based on the science and the data, not on individual companies.
Instead of offering booster shots to highly vaccinated, wealthy nations, the WHO's Director General on Monday said companies like Pfizer should send those vaccines to the WHO to give to poorer countries whose unvaccinated citizens desperately need them against a Delta variant he described as, quote, ripping around the world at a scorching pace.